Hello, my dear students. Today we are going to see about techniques of therapeutic communication. The 12 techniques is there in our psychiatry. The first one is listening. Listening in the sense, the most important thing we should understood that we has to listen what the patient is coming to say, because communication is the base part of our psychiatry. So when you are asking something, what type of answer the patient has giving, so that is the most important. That is the first technique we have to use for maintaining a communication, that is listening. Whenever you are asking something, what type of a communication, what type of answer they are giving, so it is an active process of receiving an information, that is maintaining an eye contact, etc. We have to collect some information, that is we have to listen what they are coming to say. That is the most important first step in techniques. The second technique is broad opening. Broad opening means we have to encourage the patient to select a topic. Actually, if they are started to communicate with you, means you have to notice that what type of problem the patient is having. For example, either they are admitted with a depression or mania or schizophrenia, what type of condition first you have to notice. According to that, you have to choose a topic. Example, if they are admitted with the depression patient, mostly they won't able to like to eat food, and they won't able to mingle with each other. So for that, you have to select a topic for them. What type of food you will eat, you can able to eat, which type of food you understood. So like that example, you have to make some topics to make them to communicate with you in an interest manner. That is broad opening. Give a topic for them to discuss a lot. The third one is restarting. Restarting means repeating the main thought expressed by the patient. Example. So I have given your example that 5 years old boy, they have left their mother. What type of a feel you have? That like that you have to give some expression of the patient. That is, you have to give repeating the main thought. What is the situation has changed the patient to become a psychiatric patient? Why they are admitted into the hospital? What is the exact reason to do like that? So we have to ask them to repeat the exact reason. What is the main cause of getting these mental disturbance, these psychiatric problems? So this is restarting. You say that your mother left you when you were 5 years old. So you have to repeat their thoughts. When they become a 5-year-old, what is that happening? Like that you have to repeat their thoughts. The fourth one is a clarification. Clarification is, I'm not sure what you could mean. Could you tell me about that again? That is, what they are coming to say, you have to ask them again. I can't understand your concept, what you are coming to say. So likewise, calmly you have to get the answer from them more. See, why we are getting a clarification means, if a patient say one answer from the first time, when you are asking second time the same question, they have to give the same answer. But most of the patient, they won't able to give the same answer. Why? Because the bipolar disorder or any schizophrenic patient, they couldn't able to give the same answer as much time. Whatever the time, if you are asking to a normal person, they will give the same answer. But psychiatric patients, they will give different answer for one and next time. So for that, we have to get a clear content from them. So for that only we are using the clarifications. See, reflection means directing back the patient ideas, feelings, questions and content. That is, you have to ask the patient that example you had with your husband last night. So from that we could be able to understand the respect and the feelings or empathy about the husband and about the patient condition. So that is the reflection technique we have to use. The sixth one is the humor. Humor means what they are exhibiting by their feelings, what they are exhibiting through the communication. If you are asking something now, what type of answer they are giving? Either they are giving, that is humor in the sense they will give some that is laughing things. That is what they are saying. When we are thinking, we think that why these people are behaving like this. Likewise, we will have some thought. So that is humor. See, the seventh one is informing. Informing means we have to give the information. Example, if they are taking medication without knowing anything, they are taking that medicine. That is a partial insight patient I am saying. I am not saying about insight, nothing having patients. I am saying about partial insight patients, they are taking medicine. We should explain that what purpose you are taking this type of medicines. So this is the uses. Likewise, we have to inform them. That is like giving a psychoeducation. Yes, the eighth one is the focusing. Focusing means we have to expand the statement. That is, if the patient is admitted by making some fight with the family members. Example, a daughter or a son is making fight with the father, so that they'll have some depressive symptoms. For that, they are admitted with the hospital. Now, we have to ask them that explain about more about your father. That is, what type of relationship you are having. Either you can explain more, either you can able to mingle with your father or not. Likewise, we have to ask them to explain more about their father. So that is focusing. Ninth technique is sharing perception. Sharing perception. Now, perception is most important. That is, what we has to do means the perception in the sense analyzing the patient in their own way. If we are explaining something, now they has to understood that what we are coming to say. Example, if they are making an angry, we are asking some question. They are making an angry now, but they won't say they are angry with you. What they'll do means by giving a smiling face, they'll give an answer. But instead of that, inside in their feelings, they'll get very angry with you. So likewise, you can able to differentiate their feelings. Either they are getting an angry or they are getting an happiness in their feelings. The next one is a theme identification. Theme identification na we have to understood the problems or issues experienced by the patient. அதாவது we should ask them example we have to ask them யாரோ ஒருத்தரால் இப்போ நீங்கள் ரிஜெக்ட் ஆகிருக்கீங்க, யூ ஆர் ஹர்ட்டட் பை தெம். இஃப் யூ ஆர் ஃபீலிங் தட் இஸ் அன் மெஜாரிட்டி ப்ராப்ளம் இன் யுவர் லைஃப், லைக்வைஸ் யூ ஹாவ் டு ஆஸ்க் அ கொஸ்டின். ஸோ ஃப்ரம் தட் we can able to identify their themes. That is theme identification in our techniques. The 11th one is silence, means you have to ask a question. After that, just sit simply and comfortably and observe the patient that what they are coming to say. That is, give the time to patient to think and gain the insight about what they are thinking. You have to give the time to allow them to think. When you are asking question. And the last one is suggesting. Suggesting means if you are facing any problem, that time you are thinking that this is the reason for problem. Likewise, you have to ask suggestion about the patient. That is suggesting. The next one is